Working in the era of COVID-19, a safety training for work resumption. What is COVID-19? Coronavirus disease 2019, or COVID-19, is caused by the virus SARS coronavirus 2. Symptoms can appear 2 to 14 days after exposure to the virus. It is possible for people without symptoms to be carriers of the virus and unknowingly spread COVID-19. COVID-19 symptoms. Primary symptoms include persistent cough, fever over 100.4 degrees Fahrenheit, new loss of taste and smell, muscle pain, headaches, shortness of breath, and sore throat. The virus spreads between people who are in close contact with each other. Respiratory droplets are produced when a person talks, coughs, or sneezes. These droplets can land in the mouth and nose of people nearby or can be inhaled into the lungs. It may be possible to get COVID-19 by touching a surface that has the virus on it, then touching your own mouth, nose, or eyes. However, surface contamination is not thought to be the primary way the virus spreads. General practices to prevent exposure. Physical distancing. Provide at least 6 feet of separation from others. This includes riding in the same work vehicle as a coworker. Ride in separate vehicles if possible. Limit group gatherings to 10 people or less while maintaining 6 feet of separation. Avoid areas where physical distancing is difficult. For physical distancing in the workplace, stagger shifts and break times. Do not congregate during lunchtime and only consume food items in a private office or outside. Some break rooms may be temporarily closed. Ensure adequate separation between workstations and shared spaces as indicated by the graphic. Use virtual meetings and phone calls rather than in-person meetings. Hand hygiene. Wash hands with soap and water for at least 20 seconds. Hands must be washed before entering and exiting the lab, after removing gloves, using shared equipment, leaving a shared space, and after blowing your nose, coughing, or sneezing. We recommend to wash hands at least once every hour throughout the day. If soap or water are not readily available, use a hand sanitizer that contains at least 60% alcohol content. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your mouth, nose, and eyes with unwashed hands. A video demonstrating proper hand hygiene is linked on the bottom of this page. Face coverings. A face mask or cloth face covering is required on all UF-affiliated locations, except when an individual is in their private office or in an outdoor area separated by at least 6 feet from others. Masks are intended to limit the risk of the wearer exposing others to undetected illness or infections. Masks do not provide the wearer extra protection. Please note that a face covering is not a substitute for physical distancing. Face covering options. A commercially made or homemade cloth face covering is acceptable for standard precaution. This page provides a link to the CDC resource on how to properly make a cloth face covering. Loose-fitting disposable masks may also reduce droplets or sprays from being spread by the wearer. Select a 3-ply mask for optimum protection and avoid paper masks. N95 respirators must be reserved for healthcare workers or for those who work under hazardous respiratory conditions. They are not recommended for standard precaution. Users must be medically cleared to wear tight-fitting respirator and must be fit tested per UF's respiratory protection program. Face covering use. For a video demonstration on proper donning and doffing of face masks, click on the link at the top of this page. Face coverings should fit snugly but comfortably against the side of the face. Secure it with ties or ear loops. Coverings should include multiple layers of fabric while allowing for breathing without restriction. Do not wear the same mask for more than 3 consecutive hours, since accumulated moisture from your breath can reduce its effectiveness. Either discard or rotate the mask. Store masks in well-ventilated containers such as a paper bag. Do not store them in a sealed container such as a Ziploc bag. Label the container with the user's name and date of last use. Wash face coverings daily or let disposable masks sit for at least 72 hours before reusing. Never reuse damaged or soiled masks. Masks can be discarded by placing it in a plastic bag and throwing it in the regular trash bins. Never share your face mask with others. This page contains a link to a poster with further guidance. Gloves. Wearing gloves should be done as prescribed in the lab, but may not be as effective for avoiding exposure to COVID-19. Gloves might possibly get your attention before touching your face, but they are just changing the contamination from your hands to the glove. Hand washing is a more effective precaution to prevent the spread of disease than the use of gloves. As a standard lab practice, always wash your hands after removing gloves. Reserve the use of gloves for lab work. Do not wear gloves outside the lab. Video instructions on how to properly remove gloves can be found at the link at the bottom of this page. Other PPE. Lab coats must not be shared and must not be stored together to avoid cross-contamination. Store PPE in dedicated drawers or cubbies labeled with the user's name. Use dedicated safety glasses if possible. If this is not possible, develop cleaning protocols for shared glasses. Follow manufactured guidelines for proper cleaning procedure. Cleaning guidance will be provided in later slides. Wash hands after using shared gloves such as cryo gloves or oven mitts. Guidance for supervisors. Shifts and scheduling. Stagger shifts or set teams to decrease occupancy density in the labs. Account for lab disinfection times in the schedule, which should take about 30 minutes per shift. We will discuss lab disinfection in later slides. Review occupancy limits per the research resumption plan. Safety requirements always supersede occupancy limits. Review job tasks. Ensure staff has received appropriate training for working unsupervised or with limited supervision. Review procedures to ensure that they can be completed within the shift and occupancy limits. Adjust procedures as needed. Establish wellness checks for people working alone in the lab. Checks should be conducted at intervals of 2 hours and can be completed via phone call, text message, or physical visits. Call UPD if the employee cannot be reached during a wellness check. Safety requirements for high-hazard activities supersede occupancy limits. Never work alone with hydrofluoric acid, large volumes of corrosive material or flammable solvents, acutely toxic chemicals, toxic or corrosive gas, pyrophoric or water-reactive chemicals, acute biological toxin, radioactive materials, Class 4 lasers, shop equipment such as lathes, mills, drill presses, and saws. These are some examples and do not include all high-hazard activities. Account for any activities where there is a risk of serious injury or death. Day-to-day activities. Complete the resuming research checklist found on the EH&S website when you first return to your lab. If your lab has more than one door, determine dedicated entry and exit only doorways. Label each appropriately. Sample signs are available on the EH&S website. If possible, set circular traffic flow through the lab to prevent face-to-face contact between lab members. Use arrows to mark the directions. Always require hand washing when entering and exiting the lab. Stock appropriate amount of soap, hand sanitizer, and paper towels. Be mindful of delivery delays. Although not required, it's recommended to have all employees take their temperature before departing to campus. Dedicate space in the lab for storing personal items. Please keep personal items to a minimum, as they should only be items used in the lab for that day's work. Determine PPE storage locations. Remember that lab coats must not be stored together. Label storage drawers or cabinets with users' names. Post signs explaining requirements and expectations. Sample signs can be found on the EH&S website. Cleaning. Require the disinfection of common touch points at the beginning and end of each shift. Common touch points include, but are not limited to, doorknobs, fume hood sashes, handles, sinks, cabinets, shared equipment, and tools. Create cleaning stations stocked with the appropriate supplies and PPE. Appropriately label all reagents and post required cleaning schedules. Log all items used during a shift and disinfect appropriately. Be mindful of sensitive equipment cleaning, such as microscopes, and check the manufacturer's guidelines. Use EPA-approved disinfectants listed under the link provided on this page. Please note the appropriate contact times for each disinfectant, as they vary by product. Contact times are highlighted on the linked EPA page and found in the instructions for use on the product. If soiled, the surface should be cleaned first with soap and water. Dirt and grease will decrease the effectiveness of disinfectants. If you are making your own disinfectant, remember to appropriately label the bottle with the contents and date. Make it fresh daily so it is most effective. Unused alcohol solutions must be disposed of as hazardous waste. Instructions for a bleach solution effective for COVID-19 can be found on the link provided on this page. Follow bleach disinfection by wiping the surface with ethanol to remove any corrosive residue that may damage metal surfaces. Minimum PPE for disinfection are safety glasses and gloves. Sample cleaning protocol. Don minimum PPE as required by the manufacturer. This should at minimum be safety glasses and disposable gloves. Using a paper towel, wipe the surface with soap and water if soiled. Dry the area using a new paper towel. Spray the desired disinfectant and let it sit for the appropriate contact time. Bleach solution should sit for 5 minutes, and 70% alcohol solution should sit for at least 1 minute. Wipe the surface dry using a new paper towel. To remove any corrosive residue when using bleach solutions, wipe the area with 70% ethanol following disinfection. Appropriately store each disinfectant away from incompatible materials. Please note, ethanol and alcohol solutions are flammable. Bleach is also a strong oxidizer. Guidance for buildings. Buildings. Entrances. Set centralized entrances and exits if possible. Post signs explaining the rules and expectations. Post building contacts in case anyone has questions. Many of the buildings will be closed during the ramp-up period. Swipe access must be utilized for entrance. Stairways. Post directional flow signs. If no directional flow signs are located, always remember 1 occupant per flight between landings. Elevators. No more than 2 people at one time. Please try to reserve for ADA use only. Hallways. Use arrows to direct path. Cleaning buildings. Shared areas including restrooms, elevators, and meeting rooms are cleaned regularly by facility services. Departments may decide to conduct additional cleaning throughout the day. It's the responsibility of the department to provide cleaning supplies and personnel for additional cleanings. Place hand sanitizer dispensers at building entrances and near elevators. Ensure the restroom is always stocked with soap. Contact work management if needed. Reporting. Noncompliance. All university-wide noncompliance issues should be reported by the supervisor to an HR liaison. HR liaisons then coordinate with employee relations on the outcome. Outcomes for noncompliance are outlined on the linked HR's website. Reporting department or building-specific plan deviations should be done to the direct PI and then up to the department chair. Individuals should never directly confront any noncompliance issues. Reporting illness. If you have symptoms, please stay home and contact your primary care provider for an evaluation. If confirmed positive for COVID-19, please notify your supervisor as soon as possible. Supervisors will then inform the department or building manager to restrict access to the occupied rooms. The department or building manager will then contact work management to disinfect the space. Appropriate agencies may conduct contact tracing. After the space has been disinfected, the department or building manager will reopen the space. Resources. Please visit the websites below for additional information.